Hello, I'm Beth Britton. I support Dementia Community with their communications work. Welcome and thank you for joining us for our 2nd January webinar. Before we get into the topic for today, I just wanted to briefly explain a bit more about Dementia Community. Dementia Community is a charitable community benefit society, a membership cooperative that provides learning and networking opportunities for the dementia care community. We are an independent voice and inclusive organisation aiming to help all of our members feel connected, informed, inspired, empowered, purposeful and engaged in co-produced changes that improve everyone's experiences of dementia, both in care and in wider society. This webinar is just one of the many ways in which we do this. Community members own a £1 community share in Dementia Community, and membership is open to everyone. So if you aren't already a member, do join us. There are both benefits and opportunities for all of our members. My colleague David will put a link into the chat that will take you to our membership page. And you also have the QR code there if you would like to scan that. If you're having any difficulties in joining Dementia Community, please do let David or myself know, and we will do our best to help you. So on to the topic for today's webinar, which is Ask an Admiral Nurse. I will introduce you to our speaker shortly, but just some brief housekeeping first. We are recording this webinar, so if you don't want your face on the recording, please turn your camera off. Please use the chat for your questions. We will have a Q&A session, as the title suggests, Ask an Admiral Nurse. You are going to have a chance to ask your questions, so start thinking about what you would like those to be, and we will get to those during the presentation time, and hope to answer all of your questions then. We hope to have some live participation too. So if you would like to come off mute and ask your question yourself when we get to that segment of the webinar, please do let us know, and we will be very happy to hear from you. Afterwards, David will email you with the slides, and the recording will also go onto our YouTube channel, Dementia Community, so do look out for that. We will also send you a feedback form afterwards, and we'd be very grateful if you could fill that in. So let's get started. Our speaker for today, very much a colleague and a friend of mine, so it's lovely to have her with us today. Vic Lyons is Head of Digital Service Delivery and Dementia at Work at Dementia UK. Vic, welcome, and over to you.
Thank you so much, Beth, for that introduction, and thank you for inviting me to come and talk today. Hopefully you can all see my presentation on your screens, for you to have a look at and a read of as I talk to you today. I'm Vic Lyons. I've worked as an Admiral Nurse for, I think, nearly 22 years now, so quite a long time, and it's been a real privilege to work in this role. I'm delighted to have met so many wonderful families that have inspired me so much over the course of this career, and I've also worked at Dementia UK for about 18 years, so since we were a very, very tiny charity to the large national charity that we are today. So lots and lots of passion and experience that I'm delighted to be able to share in a very whistle-stop way with you today. So what I'm going to cover today, what you're going to hopefully get out of this session, is a kind of overview of Dementia UK and what we do and how we work. I'll tell you a little bit about the evolution of Admiral Nursing and the way that Admiral Nursing has changed, and give you some tips. You know, perhaps you're sitting here and you're interested in becoming an Admiral Nurse in the future, so I'll tell you a little bit about that. I want to share a brief tip about how to work with people with dementia, how to support people with dementia for nurses, whoever you are, because I always use the opportunity to kind of hopefully get you to go away from this session with something in your mind that might help you going forward in your careers if you're joining this as somebody who's in a professional capacity, and also outline the ways that we support families living with dementia at Dementia UK. So all of that's to come. And we have, as Beth mentioned, got a slightly unusual part in the middle, perhaps with a live element, where I'm going to pause for a little bit of me talking and give you the opportunity to ask me some questions. And they can be anything you want, honestly, you know, providing it's to do with dementia, obviously, but please do feel about those questions that you might be able to ask me. So what is Dementia UK? Well, we've had various names over the years, but the name that we use as a charity now is Dementia UK. And we're a specialist charity that supports people living with dementia via our Admiral nurses. So our Admiral nurses are specialist nurses who are there to work with the family, the person with dementia, and offer them that's tailored, bespoke support. It's entirely provided by our Admiral nurses at the moment. We have in the past had conversations about, could you have an Admiral OT? Does it have to be a nurse? But at the moment, we're very much, this is a specialist nursing charity. Admiral nurses are registered nurses. I will tell you this again and again throughout this presentation, but they're a registered nurse initially. And what we do is once that nurse comes to us and is appointed is we work with amazing colleagues over in LEAP, and we'll look at getting somebody who's got the right skills and knowledge to become an Admiral nurse, and then we do their continuing training and development to make sure that person has got the specialist skills that we know families need. As I mentioned earlier on as well, we support the whole family. So we're not just thinking about the person with dementia or the family, but we're thinking them holistically together as a unit. And families are not just made up of your actual family. It could be your friends, your people who are important to you, your neighbours, people who are significant in your circle of support. And that's the type of people that we could potentially work with and support. It will vary because we've all got different support networks. So for some people, it will just be family members. Other people, it might be up to 40 people in someone's family, or, and that sounds extreme, but that's a case that I worked with years ago where I actually supported 40 members of the same family. It was a couple who had 8 children. And the lady with dementia had living siblings, and each child was married. So it just ended up being a huge number of people that we were able to provide support with. What are Admiral nurses? As I said, they will depend, what they do and how they work will depend on, where they work. So we work in a number of different settings. So some of our nurses will work in community mental health teams. They will be working alongside the clinicians in those teams to offer support to people who are under the care of that team normally, which is slightly restrictive because, of course, not every single person with a diagnosis of dementia is going to go anywhere near a community mental health team. So we also have nurses who work in primary care services with GPs, in that much more kind of where people are more likely to be supported. And I think this is a really good model because actually that's the place where you need the most support. When you think about the diagnostic process, it's at that point, how do I get a diagnosis? What support do I need once I've received this diagnosis? That's where an Admiral nurse can really make a difference. Plus, how do you manage things going forward over the course of someone's dementia? So primary care, again, really sensible model. We have nurses working in acute hospitals, which is one of those models that works well. But if you consider in a 600-bedded hospital, you might have 200 people with dementia. Can one Admiral nurse cover and support all of those people? No, of course they can't. But what they can do is input into the policies, the strategies, making sure that things are, excuse me, dementia considered and thought through, and that the mechanisms are there to support people who are under the care of that acute hospital with dementia. The other slight issue with acute hospital is, of course, they're usually in communities. And if you've got a nurse in at that acute hospital, they can support people in the door of that hospital, but sometimes not if that person lives on the street right outside the hospital, which is a slight flaw in that model, but that's where that sits. We also have nurses working in care homes to support people who
Sound.
are. I can hear some talking. Is that
Sorry.
okay?
Yeah, I think that was just somebody who'd come off mute by accident.
Oh, okay. I wasn't sure if it was a note for me to notice something. Thank you. So we have nurses working in care homes, and obviously providing support to the staff working in those care homes, to the residents in those care homes, and to the families of people who are in those care homes. We do have nurses working in hospices, supporting people at end of life. Yet, again, for that model, we know that perhaps people with dementia won't necessarily get to receive support from a hospice. So, there's work to be done perhaps around that model. We have nurses working with other voluntary sector organisations, and that will depend on what that setup looks like, how that works. We've got a couple in domiciliary care, providing support to national companies providing domiciliary care. And again, they're able to offer strategic advice, education to the staff within those services to ensure that where possible, the experience of people supported by that domiciliary care provider living with dementia are considered and well met. At Dementia UK, we are one of the largest employers of Admiral Nurses. This won't surprise you, and it's of course right that we would be. We have lots and lots of nurses who work for us at Dementia UK on our delivered services, so on our helpline, on our clinics, delivering appointments to people, and also nurses who work in our academy who are involved in practice development, nurses in my team, which is the Dementia at Work team, the digital team. And so we do have lots and lots of Admiral nurses who work at Dementia UK. And brand new from this year on, we've also got 2 nurses who are embedded into a relationship that we've got with the Nationwide Building Society, which is a real brand new evolution of nursing. So we've got the Nationwide Building Society partnership, and what they asked was, could we have these 2 nurses that worked with them to support their staff and to support, looking at the business challenges, the things they want to do as a business, as an organisation, and really being able to give them advice and consultancy around actually the impact that whatever it is they want to do might have on people with dementia. How can they support their staff so that if someone with dementia comes into their building society, they know how to give them the right level of support? Is it signage? Is it quiet spaces? Is it thinking about the digital platforms that they have and thinking, actually, how can we make sure these are accessible to people with dementia? So that's kind of where we might work and where you might find Admiral nurses working. So we have nurses who work at specialist consultant levels, so nurses who offer advice and support around different areas. So we have got nurses who work, excuse me, my voice is going. We've got nurses who work with people with dementia with Lewy bodies. We've got nurses working in frailty. We've got nurses who are working with younger people with dementia, and they're employed by Dementia UK. And if somebody phones our helpline or gets in touch with us and needs some specialist support, we can signpost to these nurses. As of last year, we also employed a nurse to support people from the LGBTQ plus community and also children whose parents are living with dementia. So we're constantly evolving those kind of specialist consultant layers of support that we can offer people. Again, slight challenge with some of those posts is, if you're a national post and you're one person, you've got to kind of consider how much reach you can have and how much support you can give to people. But that's something we're constantly looking at and evolving and adding to those services as well. We have, I'm sure lots of you across this call will know about the clinical services that we provide, so about our helpline, about the appointments that people can book. They're all there on our website for you to have a look at. The other thing that we as Admiral nurses do, which I think is a really lovely thing, is we're really actively involved in developing our website. So the content that we have on the Dementia UK website is content that has been created and crafted by our Admiral nurses as well, because we want to make sure that the content is of a really good, high quality, that it's not it's clinically right, it's correct, it's actually the information that's from our Admiral nurses, rather than just because somebody has wrote it. So we want to kind of sense check it and make sure that it's the correct information. And we're really lucky, and I mentioned LEAP before, but that's our lived experience panel, and they also help to look at the resources that we put on our website and make sure that they are as considered and appropriate as possible when it comes to kind of the messages we want to convey and the information we want to give to people. We want to support the whole family. So if we're writing a piece of content or we're putting something out, we'll be thinking, there's a person with dementia going to read this, there's a carer, there's maybe a young person. How can we make sure that this is accessible to all of those people? We do work with businesses and corporates. So my team at Dementia UK, so we do this work. So we know that, as retirement age changes, people with dementia are likely to be in the workplace when they first experience some signs or symptoms of dementia. for a percentage of people. And we also know that there's lots of people who will be in the workplace who are also in a caring role because they're supporting either a parent or a sibling or a partner with a diagnosis of dementia or signs of symptoms of dementia. So what we wanted to do was something quite unique, really, in enabling businesses to think about what support they could offer to their staff and to their customers, what they need to know, how can we make sure that they're aware. So if you've got a lady coming into your shop several times a day, perhaps, like my grandma did this. My grandma had dementia and she used to like, I don't think she'd mind me sharing this, I don't think anybody in my family would. She used to like going to the off license and buying a bottle of whiskey. And this was what she would do that usually kind of probably once a week, just a little miniature bottle, but she'd go and buy her bottle of whiskey. As her dementia progressed, she would go in several times a day and buy this bottle of whiskey. She wasn't drinking them because she was taking them home and, keep putting them in her kitchen or in the kitchen cupboards or sometimes down beside the bed or in the bathtub or all sorts of different places. But she was going in and doing that. And if she went in and she had no money, she would get quite cross because this is before the time when we were all contactless. And, so if she perhaps had £20 or however much she'd had and she'd spent it all on whiskey and she'd go to the shop and she would want to buy the whiskey and didn't have the money, it used to cause a bit of friction perhaps between her and the shopkeeper. To one point, she was actually nearly arrested because she was trying to get out of the shop with the whiskey and couldn't understand why she wasn't being allowed to leave with it. And we were able to work with that shopkeeper to say, look, in this situation we'll give you some money behind the till, just we'll bring the whiskey back. We won't contaminate it. This is a long time ago. Actually, I don't think he was really concerned about it being contaminated if it left the shop with her. But we were able to think creatively because there was a real problem being caused by what was happening. But we didn't want to say to grandma, you can't go to the shops and buy your whiskey, because that's what she wanted to do. It was kind of what she did during the day. She also did the same thing with the charity shops. So we had to work quite hard with some of the local businesses to say, we want her to have her independence to be able to do these things, but we want to be able to do it in a way that's safe. And I suppose for that business, luckily, I was able to work with them and give them that advice. But what we now do at Dementia UK is we work with businesses when they get in touch with us to sort of say, how can we help you? What's going on? Some companies might be companies that have 18,000 staff and they go, well, we don't really do much for people with dementia. We don't really know when there's carers around. We don't really know if people with dementia use our services. But then when you start looking deeper, they go, oh, yeah, of course they do. Of course they do. So it's actually getting them to think about that kind of thing as well and think about what's their corporate responsibility to their staff and customers. What can they do to make the world more dementia inclusive for people? We spend quite a bit of time responding to government policies when there's things launched. We want to kind of make sure that the voices that we want to share are heard. So, I'm going to a round table to talk about working carers in a very short space of time. And, we when there's national consultations come out, we respond to them to try and take the experience and the knowledge that we have, that the voices that we've heard, the stories, the people we've worked with, to these tables and make sure that they're heard, as well as obviously taking our expert specialist opinion to those tables as well. We do lots of talking at events, conferences, work in the media, and we think it's important to do this because we want to raise awareness of dementia. We know that 1 in 2 of us are going to be impacted by dementia in our lifetime. So how do we take that message out there? How do we get people to know this fact, but also feel hopeful about it, to kind of use that strengths-based approach so that you can go, okay, this is what's happening, but how do we do this in a way that is not knee-jerk, not necessarily negative, but let's just think pragmatically and think, okay, what do we need to know and do in order to kind of move with society and what's going on? I didn't mention our academy team, which I should do, but we do have lots of nurses who work in the academy team who are there very much looking at the development and the skills and the things we need to do. to support the knowledge and learning of all the Admiral nurses working. And we've got about 460 nurses at the moment working across the UK. This is just a bit of a summary in lots of ways. So we work with families, we work with other professionals, we offer advice on care, advice on the support needs of carers, and that will be different. Every carer, every person with dementia will have different needs, but we will assess that person and work with them and offer advice that's appropriate to them and very much bespoke to them. We do lots of work around raising awareness. We deliver masterclasses to businesses. And we're involved in that kind of advocacy work to increase support for people living with dementia and their families. So how do you become an Admiral nurse? Well, that's easy. You look for a job and you apply for a job. So Admiral Nurse, it's a registered nurse. I said that at the start, and I said I'd say it again. If you're listening to this and you're a registered nurse and you're listening to this, so presumably you're interested in dementia care and working in dementia, look for a post. We advertise our posts on the website, so do look for those posts. Consider the criteria that's been set for that post. And actually, is that a post that appeals to you? Would it be one that you would want to go for? So, do look at our website and look at the posts that we've got out and available. But the other thing you can do is if you live in an area where there isn't an Admiral nurse and you don't really fancy relocating to, I don't know, wherever there's a post available, is you can have that conversation with your managers, your teams, and sort of say, look, we have X number of people living in dementia in our area, in our geographical area. We've got this assessment profile would suggest this is a gap in service provision. How are people getting support post-diagnostically? Raise those questions and ask and have those conversations. Don't do it on your own. Come back to us at Dementia UK and we can have that conversation with you about how you can develop that model. But please, if you're in an area and there isn't any Admiral nurses, feel free to reach out and contact us because we do want to develop it. Ideally, we'd like to think that wherever there's a person with dementia, if they need support of an Admiral nurse, we'll be able to provide them with some support. We've got a little way to go to get that yet, but that's the kind of hope. We do have a module on our website, which is around dementia care modules. It's pre-Admiral nurse module. And that's on our website. One of the things I would always stress is if you're applying for an Admiral nurse job, one of the things we like to see in the application is somebody with that kind of commitment to continuous practice development, professional development. And I know that's difficult. I know for many people, you're working in an area where training, resources, and budgets might be difficult to come by, but it could be reading a book, reading an article, doing something. Every time we recruit, you would expect people to come and say, yes, I'm passionate about dementia care, but we really are looking for people who can demonstrate that passion by things they've done on top. And it doesn't have to be PhDs or masters, but it just has to be somebody who says, actually, this is the kind of practical implications of the passion that I have. These are the things I've done. This is the learning I've done. How I've kept my skills and knowledge up to date as much as possible. I told you I wanted to show you some stuff for all nurses because, it is always some useful bits that I think I would like to share. So I've divided this into two columns, but actually there's a lot of crossover between the two. So my tips in relation to a person with dementia and supporting them, it sounds so obvious, but see the person. Don't just see the diagnosis. Don't just see the dementia. Don't allow this diagnosis of dementia to stop you seeing the person. And we see this unfortunately quite a bit. So my mother-in-law's living with dementia at the moment, and so she was recently in hospital. I'm her main carer, and people were almost kind of, they wrote dementia above her bed initially, and I was like, well, hang on a minute, let's not write the word dementia above her bed. So it's just think, actually, yes, she does have this diagnosis of dementia, but that's not the most important thing about her. That's, it's not that. So kind of see the person first. I really like things like the VIP models, actually valuing the person, seeing them as an individual, understanding their care needs and thinking about how can I support this person as a whole. So what's that person's environment like? What sort of support do they have around them? What's their social network like? What's, and actually kind of really considering all of the aspects that make a person a person. So always say listen to what the person is saying. It's really easy, I think, when someone's got a diagnosis of dementia, sometimes if they seem a bit muddled, to kind of not really listen, to kind of think, oh, well, I think I know what they're saying, or I'm making this assumption, or I'm not even going to necessarily give them time to express what I want them to hear, because really I'm here to do X, Y, or Z task in a hurry. So take the time to listen to what someone's saying. But whilst you're doing that, observe what they're not saying. So if someone's saying to you, oh, yes, I understand and it's fine, but actually they're pulling away or they're wincing or they're showing you discomfort or displeasure in their face, observe that and think, okay, so the words that are coming out perhaps aren't matching. And you would hope we would do this with anybody we're caring for, right? So it's not rocket science, but just think about actually what someone is saying, but then also what their body language is perhaps saying as well. Take your time. Please try not to rush things. And I know this is busy. I know if you're working in a busy acute hospital or somewhere like that, time can be pressured. It can be really, really difficult. But try to take the time and to say things again, to maybe rephrase things, use a different terminology. If you think somebody hasn't understood what you're saying, rather than just kind of going, oh, they don't understand and turning away and talking to somebody else or writing down in someone's notes, tried to explain, don't think they understood, and contacted carer to have this conversation. So take your time, try to go through things again if you need to. Eye contact is great. I know in situations like this it's really hard. How do we have eye contact? But ideally, if you're going to be talking to somebody, maintain eye contact. Don't be leaning above somebody, having a conversation, especially if you're delivering personal care. Make sure you're approaching that person and getting eye contact. Speak clearly. Don't rush ahead. I'm really mindful I'm speaking so fast today, but you wouldn't want to talk like this. You'd want to talk in a calm, clear way, um, and kind of explain the steps that you want to go through with somebody as much as is needed. For some people, you won't need to do that because they'll be early enough in their dementia that you won't need that level of explaining. For other people, you really want to, like with my mother-in-law, we have to really break things down into steps, rather than say to her, can you go to your bedroom and get dressed? She would not manage to do that. But if we say, let's go to your bedroom, are these your pajamas? Let's pick your pajamas up, although nice and fluffy. Yeah, we can get her into her pajamas without any distress or upset, but it's breaking it into steps. Educate yourselves, learn as much as possible about dementia, about the different types of dementia, about the signs, symptoms, things to look out for, and also things that might present similarly but not be dementia, because some of the things, like hearing loss, for example, you might overlook, but actually, if someone can't hear properly, they're not going to be able to explain things or understand things or make sense of the world, and it may seem more confused. So check out other things rather than just thinking, oh, it's their dementia, because actually it could be that someone's got hearing loss going on, or sight loss, or dental pain, or B12 deficiencies. All sorts of things could cause the changes that you're seeing. In terms of family members, again, as I say, quite a lot of this is going to cross over here. But initially, I would say understand the relationship, understand what that family want and need. So, I've met and worked with thousands of families over the course of my career. And lots of these families will say, I accept that. That's the role I'm moving into. I'm going to be the person's carer. I deeply love the person I'm looking after. I don't, I will I will take on whatever tasks need to be taken on to support my person with dementia. But equally, other families will say, do you know what, actually, I've never had a great relationship with mum or dad or whoever it is, or my partner really doesn't like me spending this amount of time with my mum, or this is causing a problem, or I'm really worried, it's about their safety or their relationship, or yeah, we're all okay, but my brother isn't somebody who is really involved. If he comes around and gets involved, it's likely to upset mum. And so just think about the family and the relationships around that person, and don't make assumptions. I worked with a doctor years ago who said to me, and I quote him so often, he must be he must be spinning, I suppose, but he sort of said to me, well, she's the wife. If her husband's now got dementia, she said in sickness and in health, he's not well. It's her job to support him and to look after him, and she shouldn't need extra support to do that because that's her role as a wife, and she should look after him and understand him. And it really wasn't that practical, given what that wife was saying, that she could no longer manage and couldn't actually support her husband anymore because his needs has escalated. Treat family members as experts, as equals. I think we're quite good at times at thinking we know best. We know the decisions, we know the care plans and the packages that somebody should have. And sometimes families don't have the voice that I would like them to have in this space. And it's actually making sure that we value people and we value their contribution and the supports that they can provide to somebody isn't taken for granted, but you're kind of thinking, actually, how can I enable that person to support their loved one in the way that they want to? Obviously, we have got Admiral nurses working in some areas, so if there is an Admiral nurse working in your area and you think this person needs additional support, do look at how we can provide support through Admiral Nursing. Or indeed, if they're coming to you with really complex things that they need more support and advice about, you can always let them know about our helpline where they can phone us or they book an appointment and have a more detailed interaction with us, even if they haven't got a nurse in your geographical area. The other thing that I'm going to mention is about really consider the health of the main carer. There's lots and lots of evidence about how main carers often neglect their own health needs, are reluctant to take on things that they should perhaps take on to manage their own health needs. And I've worked with, again, lots and lots of families where this has absolutely been the case, and people needing all sorts of treatments and breaks and all sorts of things. And they just, actually saying, well, no, I can't because who's going to care for the person I look after if I do that? Or what's going to be the impact for the person I look after? So do think a little bit about that. The other things that people need, and I'm going to be briefer on this one really, is thinking about once you've got that diagnosis, what support do people need? Is it about everybody needs information, everybody needs to understand what's going on? Because when you get given a diagnosis of dementia, it's not really great practice to say, okay, Mrs. Whatever, you've now got this diagnosis of dementia. Come back to us if there's no medication. Come back to us if things get really bad. We would never do that with any other type of diagnosis that we might be giving people. So actually think about what support that family needs, what supports are available in the local area, what resources are available. Is it things like day centres? Is it respite care? Is it just a space to discuss this diagnosis and really think about what it means? Is it counselling services? Is it access to experts who can say, okay, it's whatever type of dementia it is, let's explain what that means, what to expect in the future, how to navigate your way through services, because it's not easy if you're given this diagnosis as a family and you don't know, actually you've never dealt with it perhaps before, so you don't know what you're entitled to or what services you can access or how to do them, or even what the implications of doing that might be. And we speak to lots of families who say to us, we got given this diagnosis and then kind of left on our own, or we were given a contact from the Alzheimer's Society who do amazing work, but sometimes it's in my local area, we had a phone call, and that was it, which was great. It was a lovely phone call, but it kind of didn't really give us much else after that in order to build forward and develop the care that my mother-in-law needs. Now I feel fortunate that I'm fairly good, I feel like I'm boasting, at knowing the way to navigate systems and what support might be available and how to support my mother-in-law. But for lots of families, that would be something you just don't have an awful lot of knowledge in and any past experience perhaps around. You may need care coordination. You may kind of meet the criteria to have some care coordination. But again, for some families, it really is a case of, here's the diagnosis, we will see you again in a year, in 6 months, or when things change. Of course, if someone starts medication, there might be some need around medication management, around making sure that someone's taking their medication the way they should, monitoring it. an ongoing prescription of that medication. But if there's no medication, for some families, it is very much kind of, here's a bit of information and off you go. And, which it isn't really something I think is ideal, but that's the reality of the situation. And then I think the other thing to say is that families can be complex. It would be lovely to think that all families are straightforward and and we all work in harmony together and agree what needs to happen, but actually that's not true. So for some families, it's really important that you've got access to somebody who can help you navigate in a really practical way, who can help you think about the kind of financial planning, the legal planning, the adaptations that somebody might need to keep them safe in their own home, the care options that are available, and help you deal with the emotions that come with a diagnosis of dementia as well. Actually, what does that mean? What does it mean for yourself? The number of families who say to me, "Oh, well, now, am I going to get this one day?" Or what does that actually mean? And it's that kind of level of support that we as Admiral Nurses can provide. So I'm going to pause and I'm going to ask you if you've got any questions that you want to ask me.
That's amazing. Thank you, Vic. I don't know if you want to stop sharing your slides for a few minutes so we can sort of see some of our audience, hopefully.
Yeah.
Amazing. So does anybody have a question for Vic? I've got loads, but I'd rather if someone else has something to ask that they had their chance. So anyone got a question you'd like to ask, you can pop it in the chat or you can raise your hand, come off mute and ask Vic directly. While I give people a moment to sort of think about that, Vic, when you first see those concerns, or somebody has put a question, I'll just ask this, and then we'll go to that. When you first start to have concerns about a loved one, how do people cope with that feeling of just sheer panic?
Yeah.
That and that step to the GP that might actually result in that diagnosis and that life-changing moment. Any advice from that Admiral Nursing perspective?
Yeah, no, fantastic question, Beth. So I think when you first start to notice changes in a loved one, and essentially that's what we're talking about. We're talking about changes. Initially I always say to people, don't assume it's dementia. Assume it's possibly something else, and we'll make that diagnosis by kind of a process of elimination, if you like. So, you want to go to your GP, you want to say to your loved one, do you know, I've noticed a few changes, I'm just a bit concerned, or, perhaps there's something going on that the doctor can help us with. And, for lots of us, we're used to going to the doctors when we've got concerns or we've noticed some change in ourselves. So that doesn't feel sometimes too alien. So you go to the GP, the GP will do a blood test again. Most of us are quite familiar with going for blood tests. It's not too difficult or too invasive at this point. And that blood test will be able to look at the all sorts of things. They'll do a full blood test in terms of what's going on for somebody. So, is it perhaps B12 levels are off? Is it too much? Whatever it could be. I could go through a list of all sorts of things that potentially that blood work would reveal was going on for that person. You also want to look at things like hearing, sight loss, to holistically look and say, actually, what's changed? What's going on? What's happening? Is it isolation? Is it loneliness? Is it depression that's causing these changes? Is it a UTI? It could be all sorts of things. So you do that thorough assessment to try and work out actually what's going on, what's causing these changes for this person. And then the other thing I would say to families is to write things down, because you will go to speak to the GP and you will go, oh, I'm concerned there's some changes in mum, and suddenly go, oh, I can't really articulate them, or lots of families do this. So writing them down beforehand to say, these are the things we've noticed, perhaps mum's, and it's not just getting muddled when she goes to out of the room and into another room, or, it's things like perhaps isn't aware she's had a meal, or isn't getting dressed, or isn't going out as she would, or has got locked out of the house, or has got lost on the high street. And these changes, think if you can as to how long they've been going on, so you can give as much detail as possible to the GP about what you're seeing and observing.
It's really helpful, Vic. Thank you. Right, we have, I think now, lots of questions, and we're going to end up with so many questions. We haven't
I'll
got
be
time
brief.
to, to answer them all. So first and foremost, I'm going to go to Chris, because I know Chris is living with dementia. I don't think you'd mind me saying that, Chris, and I want to give you the opportunity to ask your question. You've got your hand up.
Hi, Chris.
Yes. Hi, thank you, Beth. Hi, Vicky. I just want to sing the praises of the Admiral nurses, really, from my experience. Um, I was initially diagnosed with vascular dementia, and then I was diagnosed with Parkinson's disease. And I moved from Wales to England, and I didn't realise that the NHS systems don't speak to one another in England and Wales. They don't share information. So after 4 years of nagging my GP, asking if I could see a neurologist because my symptoms were changing, I did see a neurologist and I had another scan, and then I was diagnosed with possibly having Lewy body dementia. And when I asked the consultant, "What do you mean possibly? Do I or don't I have it?" She said it can only be confirmed on autopsy. I was very fortunate in as much as the Lewy Body Society now has two, maybe three Admiral nurses working for them. And Rachel Thompson linked in with me and my partner, and the support that we've had has just been amazing. And I understand things I didn't understand now. I've given talks about Lewy body dementia. I've given some talks with Rachel. So I just want to sing the praises of the services of Admiral nurses and thank you for what you do.
Honestly, I can't tell you how much that means, Chris. And so thank you so much for doing that because this is why we do it. We do it to make a difference and to make a positive difference for people. So I know it sounds like I'm being soppy, but it really makes me feel emotional when people share that
Oh,
back because that's exactly why we do it. It's exactly why we do the work. And I know Rachel and I've known her for 22 years now, which is ridiculous. So, and she's amazing. Both
I,
Rachels in the team are
I,
amazing.
I went from feeling hopeless to feeling hopeful.
Yeah.
And I would describe myself as a dementia um can't think of the word now. Um Advocate and you
Mm.
know, raising awareness. I do everything that I can to do that, but thank
Yeah.
you so much for what you all do.
Oh, thank you. And I think one of the things you just said there, if I could just highlight, is that, feeling hopeful. And I think that's the key thing. Living with a diagnosis, I mean, nobody would choose. I don't think you would ever choose to have a diagnosis of dementia. Having said that, I did once work with a lady years ago who said, compared to her best friend who'd got a cancer diagnosis and another friend who'd got a diabetes diagnosis, she would probably still take the dementia over both of those two. But actually, once you get this diagnosis, it's how do you live with hope with it? What do you need to do to give you that hope and that sense of life goes on? It just changes.
Yeah,
So thank you, Chris.
I've heard that so often. Thank you, Chris. And I've heard so often that, the support from Admiral nurses makes such a difference to people. And I think for everyone with Lewy body dementia, big shout out, it's World Lewy Body
Yes,
Day.
indeed.
Do go. If you don't know much about Lewy body dementia, go find out. Make today your day. You go and find out something about it. And you're able to hopefully better support someone who's living with Lewy body dementia in the future. Right, I know I've got a couple of hands up. I mean, I'm going to come to you. I want to go through a little bit in the chat first. So, Jane, what support do you offer in areas where there aren't any Admiral nurses? Vic is going to share some support options at the end of this webinar. So we will get to that, Jane, if you just bear with. Helen is saying, how do you find the person with dementia? Does the GP or memory clinic or a charity refer them to you, or can they self-refer? I think I know the answer, but over to you, Vic.
So if it's slightly tricky in the ways this, in truth, you can phone our services. If you're living with dementia and you want to book an appointment or phone us, absolutely, you can just do that yourself. You don't need any referral to get to us. Just pick up the phone or go online and book an appointment, or very soon you'll be able to send us an SMS message as well and get some support that way. But if you live in an area where there's an Admiral nurse in your area, you'll have to go through the care provider to access that nurse unless they've got an open referral process. And in some areas they do, and in other areas they don't. So slightly complicated in terms of actually a nurse who can work face to face with you. But if you're not able to navigate that and work it out, come to us and we'll help you. So get in touch with us at Dementia UK and we'll be able to look and link you up with a nurse in your area.
And Vic will share all those details at the end so you know how to get in touch with Dementia UK. Right, let me come to Kate. We have got so many questions. I'm not sure we're going to get through them all. Kate, what was your question?
just very quickly, similarly to our last contributor, just to say how amazing I found your service at a distance, and particularly where there were concerns about somebody's safety. This is another family where there's somebody there was safety issues, and you were absolutely brilliant at following up. I think that was the thing that so impressed me, was that booking an appointment really works, and being phoned back within 24 hours really works. And so few services, I find, really provide that. So I always recommend people contact you for the kinds of information you provide. But I wanted to say that that particular aspect of it is really so important. And one other thing is that in London we now have a specialist Admiral Nurse for people from the Chinese community. And so you're obviously looking at groups, that minoritized groups, you may find the access to services really, complicated and difficult, but having somebody on the ground has made a huge difference here in London. Thank you very much.
Thank you so much. Thank you.
Thank you, Kate. And again, that just chimes with so much of what I hear. Right, so at the very beginning of the chat, when we opened for questions, Ashan asked if you said you have a question. Did you want to come off mute and ask?
Yeah, hi there. How are you? First of all,
Hello.
thank you, and thank you, Victoria, for giving that absolutely lovely presentation. Basically, like I work with a team. We support people with learning disabilities. So one of our residents is basically going through dementia at the moment. So as you have mentioned, we have gone through all the basic steps, like we talked with the GP and all those, with the blood works, and all of them came like unremarkable, and they're all okay. The main concern that we are having is that he is refusing food and fluid intake. So we have prompted the staff to keep prompting them, like prompting him again and again to like tried various ways, but most cases were unsuccessful. So I just ask you for advice, like what other ways we can do.
Yeah. Thank you for the question. It's a great question, and we know that when someone's got dementia, that feeling hungry, that actually can go, that people don't necessarily recognize the signs and symptoms that they're hungry, that kind of response and needing food can be lost slightly, as indeed can that recognizing thirst and needing to take on fluid. But yet we know we need to do these things. We know it's essential. So I always say make sure fluid has got to be number one, because we need fluid, absolutely. So making sure that someone's always got drinks around them, that they can reach, thinking about things like fruits, that like kiwi fruits or melon or grapes, or fruits that have got lots of liquid in them, things like soup, so that you're maintaining someone's fluid intake, because that will have very great detrimental effects if someone's fluid is allowed to drop below a certain level. Then obviously you want someone to eat still. You want to make sure someone is eating. So I always recommend little bits of finger food, smaller bits of food. If you can, encourage people to eat with somebody, because eating is a social activity. If I'm at home all day on my own, I might go buy on a bar of chocolate, whereas if my kids are at home, we would be having a meal. So, actually it's thinking about that kind of thing and thinking, well, how can I make eating a really pleasurable experience for this person? Some people go, bread's a really interesting one. The smell of bread makes us feel hungry. And which is why if you're ever going into supermarkets, they often pump the smell of bread into the area, because it makes us hungry, it makes us buy more food. So if you're trying to encourage somebody to eat, sometimes doing something like putting a frozen bread roll into an oven so that the smell of bread comes into the environment or the air, even sticking some toast in a toaster so you get that smell as well, can sometimes help to stimulate that hunger response in somebody. We have got on the Dementia UK website, we've got a whole leaflet and I think a video too with some information about eating and drinking, so it's well worth having a look at that. But hopefully that's just a few little tips as well, how you might encourage that.
Thank you so much for that advice. Yeah.
Thank you. Thank you, Vic. And I just wanted to let you know as well, Ashan, that we have an upcoming webinar. I want to say the 25th of March. I think that date is correct, where the Royal College of Speech and Language Therapists are going to be joining us to talk all things eating, drinking, swallowing, communication. So I would say that's the one you want to look out for and sign up for. They're going to be sending their dementia expert to share their top tips with us. So hopefully that will help as well. I'll whistle stop through some more questions. So we have Jason is saying, for an Admiral nurse working in care homes, what do you feel would be the priority areas of focus?
I think within care homes, I'd think about the kind of probably thinking about the use of medication that is going on across that care home. I know it's something that got really good prior to COVID times and then kind of slightly escalated again, but really think about the kind of medication, think about the environment, think about, is it noisy, busy, how structured is it, about your staffing ratios. And for a nurse in a care home, it's often thinking really strategically with that care home about the fact that how many residents have we got living in our home with dementia? What's their day-to-day life like? I know we lots of us used to do dementia care mapping quite a lot, but thinking about actually what's this environment like? What could we do to enhance it? What activities do we do during the day? Are they appropriate? For people, and sort of then thinking, how can we embed things like life story work so that we understand the people who are living with us and we can tailor things to that person. Because when I'm in a care home, I do not want to be listening to the Spice Girls and someone telling me to play bingo. It's not going to interest me at all. But what things might interest me, that they're the things that they need to really think about and tailor to me. I started sharing my slides again. I'm so sorry. I was just trying to get ready.
That's okay. I think we can squeeze another question in before we're going to get to a question that your slides are going to cover. So I'm really happy that they're queued up, ready to go. So Daisy is saying, you spoke about the work with the Nationwide in the banking sector. We're now seeing older carers who don't have their names on their spouse's bank accounts, but still have bank cards and are taking money out. This is obviously outside of safeguards. I would be keen for banks to look at how they respond to these issues. Do you have any experience with your Nationwide partnership of helping carers to deal with these complex issues? So issues around banking, dementia and family carers, Vic, is that kind of coming to your world?
It's exactly coming into our world, and it won't surprise you at all. All of the, every bank and every company are always thinking about vulnerable customers and how do they protect their customers, and there's lots of levy towards them from doing that as well. So yes, we have had these conversations, and there's certainly the ones that we're working with, like Nationwide, we're trying as much as possible to kind of help them and to influence those decisions and the way that things happen. And people will be members of Nationwide, for example, who may be subject to fraud and all sorts of other things, and we can help with that as well when it's a person with dementia. So yes, you're absolutely right. It is an issue, and then you also have the other issue where somebody might have the LPA for their loved one with dementia, and for finances it might be registered. And the daughter I spoke to before Christmas was really beating herself up about the fact that she was now LPA. So could she buy Christmas presents for herself from her mum's money? And she didn't think that she could. And I was saying to her, well, would your mum normally buy you a Christmas present? Is it reasonable? If you buy a brand new BMW, it might not be reasonable. But if you buy something that was in the reasonable bracket of what she would have bought you, it's fine. But finances, legal, banking is such a huge issue, and in truth could be an hour-long conversation. But yes, it's a really good comment.
Yeah, thank you. So the next question is, do you cover the Yorkshire area? So let me hand over to you for you to share with us. I know you've got it on the slides.
Yes.
The ways in which people can get in touch with Dementia UK, because we promised that earlier.
Thank you. So I'm going to just tell you some of the ways that we can support you and how you can get in touch with us, and I'll try to answer as many of the questions as possible. So I mentioned the consultant Admiral nurses, so they're the nurses who are working those specialist areas. So we do have a number around who work in those roles and in those areas. To get access to those nurses, because it could be so wide, we can't just have a phone number for the Lewy body nurses, for example, on our website. Say call them if you want to. So what we've done is we've kind of said, can people go through our helplines, through our appointments, and then we'll refer through if we need to. And equally, all of our nurses are quite equipped at dealing with all sorts of types of dementia, and they've got all sorts of knowledge. So they may actually think they can provide that support without needing to refer you through to the specialist, or they may decide actually, that referring through to one of the specialist consultant Admiral nurses is absolutely what's needed. We've got loads of information on our website and loads of videos, and I mentioned the eating and drinking one, and we've got videos and resources on there. We've got stuff on there about how to get a diagnosis, which I know was one of the other questions, and what to do. So do look at the information on there. And what we've done is we've got the information available that you can read. And what we're trying to do now is make sure that we've got video content for all of those information sheets, because we know for some people reading a long document might not be the best way for them to take on board that information. So we're making these videos as well to sit alongside that. We've also done a podcast last year. So we've got a Dementia and Me podcast, which you can download from wherever you download your podcasts, if that's what you do. And that's two Admiral nurses. One of them, well, they're both amazing. One of them's me. Sorry, I'm being really big-headed. Talking on the podcast with some wonderful families who we spoke to. So Hilda and I developed these podcasts with a number of families who graciously shared their story and their experience, and then we shared some tips and advice at the end of those. The Dementia at Work team can do the sessions and the masterclasses with families. But the other thing that we do as well is we're just about to launch, what is it, March, we're going to be launching 2 guides which are aimed at keeping people in work, if that's what they want to do, keeping carers, people living with dementia in work, and making workplaces more dementia inclusive. We've got our helpline, so if you want to know where if there's a local nurse in your area, whilst it might feel a bit odd to say phone the helpline to do that, we did used to have an interactive map on our website, but because services move around or change, or their referral criteria can be quite complicated in terms of who they'll see and who they'll support, rather than having information there that led people to think there was a service, perhaps it wasn't quite the service that they could access. At the moment, that's not available on our website, but do feel free to phone our helpline to get some information about that. The new thing we're launching next month is SMS support, so people could text us to get support as well. Then there's our Dementia What Next programme, which is a fantastic new offering from us, which we launched in November last year, which is a series of online webinars that you can sign up and go to. You can go to them if you're a professional and you're interested and you want to know more, if you're a family member, if you're a person living with dementia, anybody can go to them. And we it's a series of 6 webinars, and we cover all sorts of things from getting a diagnosis through to living with dementia, through to finances, legal, end of life care planning, and that's all included in that webinar series. The other thing that we have as well, which is available via our website, is appointments that someone can book, but to see somebody in a nationwide branch. So you don't have to be a nationwide member, but it does mean that if we haven't got a local nurse in your area, or even if there is a local Admiral nurse in your area, if you choose, you can it's a travelling roadshow, the clinic essentially. So if they're in your area and you want to go and see them, I think they're in St Albans at the moment, you can go online, you can book an appointment, and you can go and see an Admiral nurse that way as well. So that's something that we've been able to do in partnership as a result of the partnership with Nationwide. So I know I've got a thank you for listening rather than any questions, because I was really mindful we've got the question chunk in the middle. But if there is any questions, I suspect we're over time or right at the end of time, but I'm happy people to send them on to me afterwards, or whatever you think. But thank you, everybody.
We are very much kind of at the end of time. I think we answered Maria's question, do you cover Yorkshire area with your advice to phone the helpline? Let's find out, Maria, find out directly from the helpline what is available. Yorkshire obviously is a really big county. Chris is pointing out Lewy body dementia is the second most common form of dementia, but the least diagnosed. I think, yeah, absolute call to action. Everybody do go and find out about Lewy body dementia. Today of all days, World Lewy Body Day. Jason, I read an article that red plates can increase appetite. Is this true?
Sorry.
So Jason says, I read an article that red plates can increase appetite. Is this
Okay.
so it's about those sort of environmental changes? I've got
Yeah,
something
yeah,
I
yeah.
would add as well, Vic, but I'll let you say yours first.
So what I would say around this is I personally I'm not sure about the colour red as such. I think it's a contrasting colour, it's a different colour. I think white, food on a white plate might not potentially stand out. For me personally, I think red plates are something that are a bit unusual. And I've certainly used them with people where they've kind of not they thought they were going to be really hot or being a bit confused about them. But then again, other people they work brilliantly. So yeah, having that contrasting cutlery, if red plates may indeed work, and it'll help somebody to see there's food there and to identify the food. So which is really what you want. You want that contrast and not kind of white plates, white serving mats, white tablecloth, because someone's not necessarily going to be able to pick out and distinguish that. So that's I think I would answer that one.
Super, thank you, Vic. And I would say on that one, so that's Jason who asked that question. We are due to have the University of Worcester come along and do an environment webinar for us this year, where they will address all of those kind of issues around perception, colour contrast, and all those kind of things that can be really, really helpful. And I think that's pretty much it. We've got some thank yous. I do recall seeing Mac's hand up, but that was kind of up and down. So I don't know if he had a question, and we are sort of very much out of time. So it's kind of for me to say thank you so much, Vic, for sharing the fantastic work that Dementia UK do and your Admiral Nurses. Some great tips, I think, on how we can support someone as well, and for taking our questions and coming along today. So thank you very much.
Thank you, everybody.
Our next webinar is called Changing the Cultural Approach to Care with Namaste Care International, and it is on Tuesday the 11th of February. And if you scroll up the chat, you will find links from my colleague David to go and book onto that webinar, to see our remaining currently published webinar schedule, many more to come, so keep an eye on that webinar link as well, and do fill out the feedback form for today as well. And other than that, it's just to say thank you again so much, Vic. Lots of lovely comments and thank yous in the chat. We really appreciate your time. Thank you.